we talk about the data, we're also talking about the renewed federal push for a boost in testing to gauge just how widespread the virus is in the hot spots in the Sun Belt. And yet, the more testing that the United States does, the longer it has been taking to process these tests and get the results back. If anyone goes to their local city MD or whatever you have, and they get that test, it might take 5 days, 6 days. By that time, once you get the results back, it's almost useless, Max. I mean, how big of a policy concern is this?
Oh, it's enormous, and it speaks again to the lag in the data we're seeing that, anything you're seeing now, even on cases, which is one of the more, real-time pieces of data, even that lags substantially, and it lags much more when there's an acute outbreak. In order to contain the virus, you have to know who has it. People have to know so they can change their behavior. If they're waiting a week for a test, they may just make the natural assumption, unless they're, heavily symptomatic, well, I'm okay. And that's how you get, really broad and concerning community transmission. And especially as we hope over time to return to reopening more broadly, that's when you really have to get a quicker turnaround on tests so people can actually be informed and responsible.
Max, we're told this is about the science, but the approach around the world seems to be different still. It's July, and yet what we see in the United States is different to what we see in Australia, Beijing, where we've had localized shutdowns. Why is the approach so different still, even though everyone's still talking about the same science?
It comes down to the extent to which you listen to that science and the recommendations of public health experts. If different people were setting national policy in the United States and they were, listening to their health experts, we would have policy that was closer to Australia, to China, and would have from the start. I think that's really what it comes down to, because the science generally has a consensus.
Max, this is really important, these statements you're making. I'm going to try to keep the politics out of it as well. There's a sheriff out there, I can't remember the details, folks, but he's just screaming no masks. And just in the last 24 hours, he's turned around to a mask. What would happen to all of this news flow if the president showed up at an event with a mask on? How would that actually change the dialogue or the science, as you put it, Max?
I'd hope it would change it substantially, because this is the thing on which there should probably be the least amount of disagreement. Just wearing a mask when you're in a congregate setting, especially inside. It's just such a small step, and one that data has grown to support more strongly over time as people have had these sort of natural experiments in Germany and in the United States that have provided pretty convincing evidence that on a large scale, masking does work to push the virus. And it's in line with, I think, everyone's priority, which is, getting back to normal, having the most open economy you can through what will still be a significant wait until a vaccine.